Welcome to the Puzzle of Us podcast, where we are helping you put back the broken pieces of life, love, and marriage and make you feel whole again. I'm your host, Chelsea Peterson from Cache Valley Counseling. I'm the owner and clinical director here, and I have had over a decade of experience working with individuals, couples, families, all sorts of people, all walks of life, all sorts of problems, and I want to bring some of that expertise to you. Today's topic is the topic of depression, one that is a prevalent experience for many of us in this life. And I want to share a little bit of information so that you can be more informed on what is depression. Do I suffer with it? Does someone I know and care about also suffer with it? And what do I do about it? So that's today's topic, and I'm excited to just dive right in here. All right, so it is important to understand that there are different components to depression. It's a multifaceted kind of origin, right? Why is my depression happening? Why am I experiencing depression? And it's important to understand kind of the origins of that. So we're going to speak a little bit to the origins of depression and help you understand the difference between each one. So there's a genetic component, there's an environmental component, and then there's a psychological component. The genetic, just a very brief overview on all of them. Genetic is really just kind of, again, is it biologically, am I hardwired for depression? Is there some sort of maybe chemical imbalance that I experience because of my genetics? I can't do anything about it. Again, it's like diabetes. Some are more predisposed to certain conditions, heart conditions, cancer. Also, diabetes is a great example of that. Again, genetics play a big part in depression, or can play a big part in depression. There's also environmental factors. What's going on around you and what's happening in life can also contribute to depression or be a reason that people experience depression. Then there's also psychological, which is really your thoughts, and are my thoughts getting kind of stuck in this place? So we're going to do a little bit deeper dive into each one of those and talk a little bit more specific about each one of those components of depression to help just give you, again, an overview of depression and how it might be showing up in your life. So again, the genetics, we're going to go to the genetic factor of depression first, which I think is an often overlooked thing when it comes to depression. Is my parents didn't have depression because it wasn't diagnosed, right? No doctor officially told them that they had depression. But many, many, many people have a genetic component to their depression. I was reading an interesting article the other day that said white Anglo-Saxon people who originate from kind of the European cultures are like 6 times more likely to experience depression because of our genetics, right? It's an astounding rate. And I'll have to find the article and have it in the show notes, but there is a genetic component to the just underlying facets. Even if no one directly in your, wasn't my mom or my dad or even grandparents, if no one specifically in a close-knit group related to you that you know of had depression, it doesn't mean that genetic factors aren't still playing a role in depression that you may be experiencing in your life. Again, very often times when we see parents with depression, or my mom had depression, or my dad had depression, that is a much higher likelihood is going to occur. Again, I'm predisposed to some of those things. So depression is a chemical imbalance in your brain. For various reasons, it's there. In the genetic side of things, it very much can be not correctable with anything but medication. Medication plays a big role when it's a genetic factor because of the chemical imbalances that are happening in your brain, and your brain just isn't going to your body isn't going to produce more serotonin because I'm telling it to, because I said I don't want depression. It doesn't work that way. So again, those SSRIs, when you're talking about depression, become a incredibly important part of treatment if genetics is playing a factor. And you may be thinking like, I don't know of anyone, but it feels like maybe, or I fit that Anglo-Saxon type, I have those genetics in my breeding. That's a little bit more of a likelihood that something might be going on, and trying SSRIs might be a good option for you. Again, if you do well on a medication, a lot of times, again, the situational and the environmental and the psychological factors become easier if you are on a medication. So it's hard to tell if it's strictly genetic, but there is a genetic component to that. They also have tests that you can do. It's a cheek swab, and it metabolizes it shows how you metabolize medication and different medications. And so it takes some of the guesswork that we have had for many years in medication and mental health medication. It takes some of the guesswork out of that, because it's able to, just with your cheek swab, it's able to take your DNA and it's able to say, hey, this SSRI is going to be better than this stimulant, or this stimulant is going to be better than this SSRI because of how my body is metabolizing things. So check that out. Make sure that if you are considering medication, that especially if it's your first time, it takes out some of the guesswork. The trial and error is taken out a little bit. Again, doctors have become pretty good at narrowing that down, so that's not always necessary. But if that's something that you feel like you want, they're definitely out there and can certainly help shorten that guess game a little bit as well. There definitely has been a lot of research out there on genetic links to depression. Again, some of them argue, if I was raised by a mother who had depression, or raised by someone who had depression, is that hereditary or is that learned behavior? We don't always know, but there is some pretty cool science coming out that is specific to genetic stuff that's going on. I can't think myself better. I can't just tell myself I'm going to behave better or get into a better routine or set up better health habits. Those are all great. But again, sometimes those genetic components are a large underlying part of depression that really needs to be considered when you're thinking about depression, or considering, do I have depression? Genetic factors often lead more into what we call chronic depression. And chronic depression is, again, it doesn't matter what I do. I set up these systems, I set up these routines, I set up these important things that help keep me in a good mental state. And for various reasons, they don't work. So despite all your best efforts, when I exercise, when I eat right, when I do all the things, I still have depression. Chronic depression is when it's not just a single bout. There's also some research out there that every person at some point in their life will experience, if they live up to 65, will experience at least one bout of depression in their life. That's, again, it's like 98% of people experience depression at some point in their life. We all know those people that, are super happy, that are awesome, that have a great optimism, and that are seem like they're an anomaly. Even those people experience depression. And so again, those are pretty alarming, pretty high stats, in that you are at some point going to experience depression. Chronic depression is when you have, again, repeated bouts of it. It's not just an environmental factor. It's not just a psychological factor. There's some genetic components to that. And that's where, again, medication becomes kind of a key point in that. Not always. Again, there's always, I could give you outliers in every situation, but oftentimes genetic components rely a little bit more heavily on medication to help increase those chemical levels in your brain. Again, there's not a ton you can do for genetic factors that are kind of the origin or the reason that I'm experiencing depression. Getting in good routines, same thing that same treatment options exist for depression regardless of the origin. Um, but again, with the genetic factors, treatment usually includes some component of medication, whereas the other ones, sometimes it's time, sometimes it's learning new behaviors, sometimes it's doing things a little bit different. This genetic component almost always requires some aspect of medication. So the next factor is an environmental factor. So when you're talking about environmental factors, we're talking about kind of childhood trauma, stressful life events, chronic health issues. They can be huge contributors to just feeling like life is hard, because life is really hard. And it seems like life sometimes throws you curveballs at times. And those are those times that I'm referring to as these environmental factors being a contributing factor to depression. Again, if we experience childhood trauma and it stays with us for a long time and our body carries that, sometimes it becomes really difficult to overcome. And so treatment often includes medication. Treatment can include things like, if it's specific to childhood trauma, specific trauma therapies, EMDR, things like that. Again, doesn't mean that you're going to be free of depression forever, but it also may help to decrease the significance and the role that it plays in your life. Being able to help you overcome that a little bit can be really helpful. Another kind of environmental factor is substance abuse and using substance or substance abuse being present in your life, right? If I'm a child of someone who is using alcohol, any substance really, sometimes that can create an environment in which I feel alone or feel isolated or feel depressed. And at times that can contribute to that. Substance abuse can also contribute to reasons for depression. All of these things, whether it be childhood trauma, whether it be stressful life events, if we also have if we're predisposed or we have the genetic component of being more susceptible to depression or having that be more present in our lives, these moments become really challenging to overcome. Not to necessarily overcome in a way of like I'm going to take my own life, or that I get into a place that I can't ever overcome, but it just makes things a little bit trickier to navigate. If we're dealing with a low or a genetic component of it that we are feeling a little bit, if our brain isn't producing the chemicals that it's needed, and we add a stressful life event and our body is having to produce even more, let's say adrenaline and cortisol to keep us going, then our body gets more fatigued. We're not able to think clearly. We're not able to stay emotionally regulated. And then it can also cause down the road more like chronic pain. So this is important to recognize this early on, that these things need to sort of be processed through. It doesn't mean that life events aren't going to happen and it's not going to be stressful, but what am I doing in the moment to stay present and to stay focused and to get through it in the moment, rather than waiting 6 months or a year and feeling like I've been carrying this weight for a really long time. So nipping it in the bud is really helpful. Again, the preventions and interventions look a lot the same. Sometimes it's time. Chronic pain can be a very challenging thing and can be incredibly difficult for people to go through, especially if they become a caregiver or if they need a caregiver, given the chronic pain. There's all sorts of tricky things to navigate, and it can be difficult because, again, it becomes a lifelong thing, becomes a lifelong process. And it doesn't mean that you're never going to be rid of them, but it just makes it really difficult. And so again, those things are just important to think about and things to discuss, particularly if you come to mental health therapy and you come see someone like myself, it's important to disclose that all of these things are happening in my life. And talking about them and talking about how stressful it is and being able to find resolve, right? Being able to have solutions to how I feel. Being able to even just discuss and talk to someone about how difficult it is, who feels like they maybe can understand or empathize at least a little bit, can be an important part of treatment. Depression often takes us alone and makes us feel isolated. And so therapy, mental health therapy is a great way for people to start to work through some of their depression. Again, medication can be a helpful route as that. And sometimes in a case like this where it is environmental, I often tell people you don't have to go on medication and be on medication forever. Oftentimes it's a short-term thing, right? Like right now, I need a little bit of extra because my body isn't able to produce what I need. And so short-term, I get on a low dose of something that my body can process through and my body can metabolize well and things like that. And then I'm able to take it for a short bit and then wean off of it. Again, do that at the recommendation of whoever is prescribing your medication. But oftentimes, environmental factors are short-lived medication. That's when medication can be really helpful. Psychological factors can also play a part in depression. Can be kind of the origin of your depression. They can be negative thoughts that I just get stuck in this negative way of thinking. Sometimes they can be from a behavioral thing where I keep doing the same thing, like physically doing the same thing or acting in the same way, right? My behaviors are producing the same result. And I'm staying stuck in this maybe negative thinking, negative way, negative patterns. And then there's really kind of these unresolved conflicts that show up in our lives, which can also be kind of a psychodynamic way of thinking about depression. All of these things can be contributing factors to where your depression is coming from, particularly in the psychological factors when we're thinking about just there's maybe not any stressful life events that are happening right now. Maybe there's no genetical component to how I'm experiencing depression or depression in my life, but it's more of the negative thought patterns, behaviorally doing the same things that's getting me stuck in the same pattern, or these unresolved conflicts, whether it be in my previous life or even there's theories out there that kind of unresolved conflict from even years back, right? So I'm blanking on the word right now, but it's basically historical trauma, right? The stories that get passed down to us, vicarious trauma, vicarious historical trauma. If we have an ancestor that experienced severe depression or wartime trauma or things like that, oftentimes how they dealt with that then gets passed down to the next generation. And generational trauma is the word I was looking for. We get these sort of generational traumas that get passed down from generation to generation, and that often can be a factor of unresolved conflict that was seen even generations back, as well as even conflict within ourselves. Again, sometimes when you're feeling depressed, you're so overwhelmed you don't know where to start, you don't know where to begin, you don't know where to end, you don't know what the end even looks like. Sometimes we get really hopeless. And so having an idea of being able to sort of think through, is this what I'm struggling with, can be helpful in just you starting to understand your process and your relationship with depression. Again, all of these things are often interacting. Usually there's it's not just one contributing factor. There's usually a lot of things going on. There's a lot of us out there or in this world that is predisposed to having a chemical imbalance, which creates more depressive episodes, difficulties, moments in life where things become a little bit more difficult. Often, many of us have experienced childhood trauma. Many people have also experienced generational trauma and things like that. So, just being aware of them and thinking back to how they are all interacting and all interplaying, and I truly believe it is not one thing. There might be sort of, again, an origin, but it's often met with the interaction of all of these components, and that's what's creating a response in our body, or difficult response in not being able to respond. Really looking again at the whole. This is where working in a system, right? If you just go to a medical health provider that is prescribing, they may only look at the genetic component. They may not talk to you about all the conflict or the life stress that's happening right now. If you go to a therapist, sometimes therapists only focus on all the stress and external factors, environmental factors that you're dealing with, but they may miss the medical or the genetic side of things. And so really making sure that you are taking a holistic approach, looking at all of these various factors, is really important when it comes to treating your depression and getting on top of managing your mental health. Again, understanding the roots is important. It's not the sole thing, but helping just to have an idea of what's going on helps your treatment just move a little smoother. Again, oftentimes you're coming to medical professionals because I don't have any idea where it even starts, and that's okay. But having an idea after even listening to this of like, oh yeah, that sounds like it might be me, or yeah, that sounds like something I'm dealing with, or yeah, that sounds like something my partner is dealing with, and these are some concerns that I have, is a great place to start. There are lots of, again, different modalities. There's lots of different options out there. I've talked about medication. I've talked about coming to mental health therapy, like therapy specifically. There are just even simple lifestyle changes. Exercise is massively important for management of depression, whether that be chronic or genetic, or whether that just be life stress. When you're going through the middle of something, when you're feeling pain, oftentimes it's like, it hurts to move, and so I don't want to move, which then actually makes you not want to move, which makes it harder and makes it worse. And sometimes it makes it better, but oftentimes we get then stuck into these patterns that we're not able to progress. So making sure that we're really focusing on and stressing the importance of exercise with depression. There's tons of research out there of how important exercise is for the management of depression. It's very, very crucial. And again, it doesn't have to be I'm going for a 25-mile run every day. Exercise can look very different. It can be a simple yoga routine. It could be a walk down the block a couple of times a week. It could be, every day, 20 minutes, getting your heart rate up. But doing something that elevates those heart rate, that exercises those lungs, that exercises those muscles, that keeps us moving and in shape and moving forward, is so, so, so crucial. It doesn't matter what approach you take to depression. It's very, very huge. Oftentimes, watching what you eat, the intake of things, lifestyle changes can be simple. Sometimes with depression, we often get into kind of weird sleep patterns, sleeping too late in the morning and then staying up way too late at night. So just looking at all of those things, if you're finding yourself getting into those phases, making sure that those things kind of get looked at as well. Again, that holistic approach is the best approach to treating depression. Again, one size does not fit all. For me, exercise needs to be more than just a simple yoga routine. For my mother-in-law, that works fabulously. And so again, making sure that you are getting your individual treatment plan worked out, that is what can be the most beneficial in helping you manage your mental health. Depression is incredibly difficult to manage, and it's a thing that all of us will experience at some point in our life. And knowing how best to manage it can be helpful. Again, whether that's exercise, whether that's lifestyle changes, whether that's medication, whether that's mental health therapy, there are lots of different things out there that can help you manage that. But being aware of what is it that I need to feel my best? What is it that I need that is going to help me feel happiest? That's the most important thing to continue to consider. And really, again, seeking help in those moments where you feel maybe starting to feel a little hopeless, feeling like, what's the point? Feeling like I'm not enough. That's a really great time to reach out to a professional for some help. It's a really great time. If you don't reach out to a professional, reach out to someone in your circle and that can support you, that can love you, that can help you, and maybe help you make a decision on reaching out for professional support. It is important to help manage that. It is an important part of treatment, regardless of the origin of all of these different factors that we've talked about today. Thank you for tuning in. This has been a great episode on lots of different types of depression, or not types of depression, but origins of depression and where it comes from and how it can affect your life. And thank you for listening to The Puzzle of Us. Hopefully this has been helpful in helping you mend the broken pieces in your life and put them back together to feel whole again. I've been your host, Chelsea Peterson.